Good afternoon, everyone. Today, we are going to go over the special emphasis notice, the SEN applications to one, develop innovative ways to evaluate and improve the quality of healthcare data used by artificial intelligence, AI tools in healthcare, and two, accelerate adoption of health information technology in behavioral health. So this is the information session for the SEN applications under the Leading Edge Acceleration Projects, the LEAP, in Health Information Technology Notice of Funding Opportunity. So our agenda for today, we'll begin with our introduction of speakers, some reminders. We'll go over the background of the Leading Edge Acceleration Projects, the LEAP in Health IT, Health HIT. We'll go over the special emphasis notice for applications. We'll talk about the funding eligibility and application information and the application responsiveness and merit review criteria. So our speakers for today are Tavon Taylor, who's myself, who is the Grants Management Specialist for the Office of the National Coordinator Procurement and Grants Division, and Ms. Lolita Cachet from ONC's Office of Technology Strategic Initiatives Branch. So a few reminders. This webinar is being recorded and will be made publicly available. All participants will be muted during the presentation. If you have questions, please enter them into the chat box. And note that all questions will be answered in FAQs made publicly available weekly. And this is the link for where you can go and get the webinar FAQs. So how to ask a question. If you have questions during the presentation, these are the instructions that you need to follow. So you will use the chat function to ask a question. So number one, you'll see it along the bottom of the webinar window. You find and click the chat button. Secondly, you'll input your question into the chat box. And third, you press enter or return to send. If you have additional questions after today's webinar, please direct those questions to onc-leap@hhs.gov.
Thanks, Tavon, and thanks everyone for joining today to learn more about the special emphasis notice under the LEAP in Health IT Notice of Funding Opportunity. To start, we are just going to give a brief overview and background of the LEAP program. Next slide, please. Since 2018, LEAP in Health IT seeks to address well-documented and fast-emerging challenges that inhibit the development, use, and/or advancement of well-designed interoperable health IT. Applications submitted under this SEN will be funded under the LEAP in Health IT NOFO, NAP-AX-22-001. Aside from the areas of interest, required expertise, and deadlines listed in this SEN, all other requirements, application instructions, and terms and conditions of the NOFO, NAP-AX-22-001 apply, with the exception of applicant capabilities. Next slide, please. This is a competitive funding opportunity open to public or nonprofit private institutions, such as a university, college, or a faith-based or community-based organization, units of local or state government, eligible agencies of the federal government, and Indian, Native American tribal governments. For-profit organizations may participate in projects as members of a consortia or as a subrecipient only. Because the purpose of this NOFO is to improve healthcare in the United States, foreign institutions may participate in projects as members of a consortia or as a subrecipient only. Applications submitted by for-profit organizations or foreign institutions will not be reviewed. Organizations described in sections 501(c)(4) of the Internal Revenue Code, that engage in lobbying activities are not eligible to apply. HHS grants policy requires that the grant recipient perform a substantive role in the conduct of the planned project activity and not merely serve as a conduit of funds to another party or parties. If consortium and contractual activities represent a significant portion of the overall project, the applicant shall justify why the applicant organization, rather than the party performing this portion of the overall project, should be the recipient, and what substantive role the applicant organization will play. Applicant organizations may submit more than one application, provided that each application is scientifically distinct. Next slide, please. We'll now go into the details of this year's SEN. Next slide, please. Below is an overview of the SEN, which has 2 areas of interest and 1 award per area of interest. Each award will be up to $1 million with a period of performance of 2 years. Additional funding for years 3 to 5 may be provided contingent upon availability of funds, meaningful progress, and ONC priorities. Letters of intent are not required in order to be considered for an award. However, if you are planning to submit one, they are due by May 28th, 2024. Applications under the SEN are due by July 12th, 2024. The following are the areas of interest for the 2024 SEN, which Tevon had mentioned earlier as well. Area of interest 1 will focus on developing innovative ways to evaluate and improve the quality of healthcare data used by AI tools in healthcare. Area of interest 2 will focus on accelerating adoption of health information technology in behavioral health. Please note that applicants should clearly indicate which area of interest they are applying for in their application. You can do this in the project abstract or the project narrative. Application packages addressing more than one area of interest will not be considered for award. Now I'll provide a more detailed overview for each area of interest. Area of interest 1 is titled Develop Innovative Ways to Evaluate and Improve the Quality of Healthcare Data Used by AI Tools in Healthcare. The goal of this area of interest is to develop scalable solutions that can evaluate and improve the quality of healthcare data available in electronic health records, EHRs, that are used by AI tools. This goal aligns with the intentions of Executive Order 14110, titled Safe, Secure, and Trustworthy Development and Use of Artificial Intelligence, as well as ONC's Health Data, Technology, and Interoperability Certification Program Updates, Algorithm Transparency, and Information Sharing Final Rule, also known as HTI-1. Next slide, please. The key objectives for this area of interest include the following: development of scalable solutions to evaluate and improve the quality of healthcare data available in EHR technologies used by AI tools. Applicants may propose approaches that are targeted for health IT developers, healthcare providers, or both. Applicants must identify and explore specific requirements related to the EO 14110 and the HTI-1 final rules source attributes as part of proposing their solutions to address this area of interest. Applicants will also need to describe ways to scale their proposed solution across the health IT industry. Applicants have a wide flexibility to propose evaluation and improvement activities related to data quality and AI tools under this area of interest. Next slide. Applicants shall demonstrate familiarity with and understanding of the following: the EO 14110, ONC HTI-1 final rule, and specifically the requirements under the predictive decision support interventions, experience evaluating and developing improvement strategies for data quality, experience in developing and deploying AI tools using data derived from EHRs. And to be considered for an award in this area of interest, an applicant's proposal shall include propose at least one activity related to the goal and key objectives of Area 1 and provide a detailed project plan and explanation of how the applicant intends to meet the goal of this area of interest. For area of interest 2, which is titled Accelerate Adoption of Health Information Technology in Behavioral Health, the goal is to support the development of lightweight health information technology solutions using open standards that can enhance health IT capabilities in behavioral health settings with limited technical and financial resources, and improve care coordination between behavioral health and clinical healthcare settings. The key objectives for this area of interest include the following: design and develop one or more lightweight applications, such as Smart on Fire applications and Fire-based APIs, to solve a specific behavioral health use case or multiple use cases. The lightweight application must also enable a behavioral healthcare setting to access and integrate health information from other healthcare settings that use ONC certified health IT. The application must be developed using open Fire-based APIs, and applicants may also consider the standards adopted in HTI-1 as applicable for the lightweight application to access data from ONC certified health IT. Another key objective is to pilot the application or applications at behavioral healthcare settings to make the application ready for adoption by behavioral health providers. Applicants should also document approaches used for testing the application at behavioral healthcare settings to make the tool production ready. Another key objective is to coordinate input and dialogue with health IT industry and behavioral healthcare community providers to inform development of the application and share lessons learned and best practices. For this area of interest, applicants shall demonstrate familiarity with health IT standards and health IT technology, including content and exchange standards and implementation specifications, as well as behavioral healthcare systems and technology, behavioral healthcare settings, and interoperability gaps and needs. Applicants for an award in area of interest 2 shall include the following in their application: provide a detailed project plan and explanation of how the applicant intends to meet the goal and objectives of this area of interest. In the project plan, the applicant should include the attributes of the application that make the solution lightweight in behavioral healthcare settings, including but not limited to the resources required to maintain and support the application in production settings. Identify all the behavioral healthcare settings that the proposed solution is applicable, with preference given to under-resourced providers who have generally lower adoption of health IT, such as residential treatment centers, substance use disorders and detoxification facilities, and outpatient mental health facilities. Applicants must also identify at least one behavioral healthcare clinical use case based on the challenges facing behavioral healthcare providers, and provide an explanation on how the applicant plans to build a scalable, lightweight tool or resource to solve the problem associated with the use case effectively. The applicant must also identify at least one behavioral healthcare setting and a data exchange partner to test and pilot the tool associated with the use case identified. And lastly, the applicant must provide a plan for engaging with the open source community for long-term sustainability of the tool. For the upcoming slides on application and submission information, I just wanted to note that all the information can also be found in Section D in the NOFO, so I encourage you to reference back to that for any additional clarification on the next few slides. Next slide, please. So this is a summary of the key details for this SEN, which we went over previously, but awards under this funding opportunity will be a cooperative agreement. The available funding is $2 million, up to $1 million for each area of interest award. The application deadline is July 12th, 2024, and the anticipated award date is August 30th, 2024, with an anticipated start date of August 30th, 2024 for a period of performance for 2 years. Once again, there's one award available per area of interest, up to $1 million per award. While letters of intent are not required, applicants are strongly encouraged to submit a non-binding email letter of intent to apply for this funding opportunity. You may submit the letter of intent by May 28th, 2024 by 11:59 p.m. Eastern and send it to onc-leap@hhs.gov. In the letter of intent, please identify the title of the SEN and the area of interest you are interested in applying for, the name of the applicant organization, city and state of the applicant organization, and reference the NOFO number NAP-AX-22-0001. We'll now go over the application process. So applicants must submit all material electronically through grants.gov. This process is outlined in detail in the NOFO. For assistance with submitting applications on grants.gov, please contact the grants.gov help desk at support@grants.gov or call at 800-581-4726. To apply, applicants must have a unique entity identifier, or UEI. A UEI can be obtained via registering at fedgov.dnb.com/webform.sam.gov. And this typically takes 7 to 10 business days, so please plan accordingly when applying for a UEI. Applicants must also register in the System for Award Management, known as SAM, at www.sam.gov and use their UEI. The SAM registration process takes 7 to 10 business days, so please plan accordingly. If you already registered with the SAM but have not renewed your registration in the last 12 months, you will need to renew your registration. Applicants must also ensure that the application meets application requirements and page limits. For the application, these are the following components: a project abstract, no more than 500 words, a project narrative, no more than 35 pages, Form SF-424, application for federal assistance, Form SF-424A, which is budget information for non-construction programs, Form SF-424B, assurances for non-construction programs, Form SF-LLL, disclosure of lobbying activities, a budget narrative, and a letter of commitment. The next slides will go into detail of what should be included in each component. The project abstract represents a high-level summary of the project that can be understood without reference to other parts of the application, and that provides a description of the proposed project, including the project's goal, objectives, overall approach, anticipated outcomes, products, and duration. The format should be no more than 500 words and include the following: project title, applicant name, physical address, contact name, contact phone number, email address, and website address if applicable. The project narrative should address the elements articulated in the areas of interest section of this SEN. The project narrative should also align with the performance goals and objectives and merit review criteria presented. Applications that did not follow the outline format must be reviewed by an ONC designated official. The format for the project narrative should be double space and no more than 35 pages, formatted to 8.5 by 11-inch letter size plain white pages, either Cambria or Times New Roman font, 1-inch or larger margins, and font size 11 or greater. In the project narrative, applicants should include the following components, which will be counted as part of the page limit. The suggested links of the components given below are guidelines to help applicants create a balanced document. They are not mandatory restrictions. The components are understanding of project purpose, 2 to 3 pages, proposed approach and activities, 10 to 14 pages, applicant capabilities, 9 to 15 pages, and a budget narrative, 2 to 3 pages. The understanding of project purpose section should offer the applicant's conceptualization of the selected area of interest. This should include, from the applicant's perspective, a specific delineation of the objectives and research challenges, the proposed project will address, specifically distinguishing between challenges that can be addressed in the self-contained project period of 2 years and challenges requiring a longer period, 3 to 5 years. Applicants shall clearly state which area of interest the proposed project will address. Next slide, please. For the proposed approach and activities, applicants should provide a clear and concise description of the approach the applicant is proposing to use to conduct the research and development work, including identifying major challenges and proposed activities used in the approach. This section should be organized so that each element of the project plan is clear and aligns to the project's key objectives and project goals. The applicant should include the usage of novel concepts, approaches, and methodologies, tools, and/or technologies, and provide insight as to how their usage will inform the field of health IT. The approach should also include proposed strategies on how the results of the project may be disseminated and transitioned to field at large. The approach should also include as much detail as possible given the page limit. The plan for each activity at a minimum shall state specific aims, previous work of the investigative team on which the proposed research is directly based, the methods that will be applied, the anticipated outcomes of work, and their potential significance in addressing the challenges of the selected area of interest, and should also include the key personnel who will be involved. The next section is the applicant capabilities section. This section should describe the applicant's project team, personnel qualifications, and past performance demonstrating experience consistent with successfully meeting the goals of the cooperative agreement. It is recommended that the project team be comprised of, but is not limited to, the following roles: a project director or principal investigator. At least one person on the proposed team shall possess health IT expertise. For area of interest 1, the proposed research team must have expertise in the areas outlined in the SEN. For area of interest 2, the proposed research team must have expertise in the areas outlined in the SEN. Within the applicant capability section, applicants should include a plan for engaging industry stakeholders to adopt, disseminate, and transition findings from the project into data standards, data infrastructures, health IT products, tools, and best practices, and also include collaborative arrangements with industry and other groups outside of the applicant institution, should be accompanied by appropriate letters of support. In the event an applicant solution includes the development of a prototype, the applicant should also submit a plan for approval by ONC, illustrating how the prototype will be made and maintained in a publicly available and acceptable domain at no cost to the general public. Applicants should also add a section to describe plans to establish and operate a technical expert panel of relevant and appropriate stakeholders, including names of members who have committed to join or propose to join to help inform the work to be conducted on the relevant area of interest. The project management section should include a clear delineation of the roles and responsibilities of the principal investigator, participating researchers, project staff, consultants, and collaborating organizations, and how they will contribute to achieving the research objectives and outcomes. If the application includes subcontractors, plans for coordinating activities across multiple organizations should be described. This section should specify who would have day-to-day responsibilities for key tasks such as leadership of project, monitoring the project's ongoing progress, preparation of reports, and communications with other collaborating organizations and ONC. Recipients will be required to maintain information relevant to executing the proposed project plan and performance-based outcomes. The project management section should also describe the approach that will be used to assess project performance and monitor and track progress towards meeting key objectives. The application should include a detailed project timeline as an appendix that incorporates those objectives, and an organizational chart as an appendix that reflects roles and responsibilities of the project team. The final section within Section 3 is the organizational capability statement. This section should describe the organization's capabilities, qualifications, and approach to address the work to be completed. The statement should highlight potential strategies the organization may employ in an effort to sustain research efforts beyond the scope of the project timeframe. Include the relevant organizational resources available to perform the proposed projects. And applicants who are working with project counterparts as part of a consortia shall also provide letters of commitment from them. The letters of commitment shall be included with the appendices and will not count towards the 35-page limit. The final component of the application is the budget narrative. This section should include a detailed breakdown of how the applicant plans to spend the allotted resources to complete the activities detailed in the NOFO. This includes the budget narrative on how the proposed budget, as articulated in the SF 424A form, and aligns with the applicant's project narrative. Should also include an application for federal assistance, Form SF 424, budget information for non-construction programs, Form SF 424A, assurances for non-construction programs, Form SF 424B, and a disclosure of lobbying activities, Form SF-LLL. Detailed budget instructions are provided in the NOFO for reference. Next slide, please. Now we'll move on to discuss the application responsiveness and merit review criteria. Applicants must submit all application materials electronically through grants.gov. Grants.gov will issue an email receipt upon successful submission. The applications are reviewed for responsiveness and categorized as pass or fail. All applications that pass the review for responsiveness are forwarded for merit review. Once the merit review is complete, ONC may make an award. ONC is not obligated to make an award if none of the applications meet the intent of program requirements or if there's a change in funding levels or availability of funds. For the application responsiveness, applicants must meet the following completeness criteria or they will be administratively eliminated and not sent forward for merit review. The criteria includes the following. The applicant meets all eligibility criteria. The application is received by the deadline of Monday, July 12, 2024 at noon through www.grants.gov. And the application contains all required components, a program narrative SF424 and all the forms we went over previously. And the application should meet all formatting and length requirements, and dependencies and attachments are not used as a mechanism to exceed page limits of the project narrative. Now we'll go through the merit review process and criteria that will be used to evaluate applications. Once applications pass the responsiveness check, they are forwarded for merit review. Merit review will be conducted by a review panel of at least 3 experts in their field from academic institutions, nonprofits, and local and federal government agencies. Applications can receive a maximum of 100 points using the following scale and criteria. Understanding of project purpose for 10 points, proposed approach and activities for 40 points, applicant capabilities for 30 points, and budget narrative for 20 points. The criteria that will be used to assess the understanding of project purpose includes the following. The extent to which the application addresses the objectives and project goals of this NOFO, the extent to which the application identifies a project plan and activities that align with one of the 2 identified areas of interest within the SEN, the extent to which the application identifies barriers and ways to mitigate those barriers with one of the 2 identified areas of interest within the SEN, and the extent to which the applicant describes how the project expected outcomes and results will inform future health IT development, research, and implementation. The criteria that will be used to assess the approach and activities includes the following. The extent to which the approach design methods and analyses are specifically stated, adequately developed, well integrated, well-reasoned, and appropriate to the project goals and key objectives of the area of interest, which is 20 points. The extent to which the applicant proposes a clear and detailed plan for disseminating and transitioning appropriate research results into practice. This section of the application should include a plan for engaging industry stakeholders to adopt, disseminate, and transition findings from the project to stakeholders who will continue to advance the work. That's 15 points. The extent to which the plan describes a project management approach for ensuring project success for 5 points. The criteria that will be used to assess applicant capabilities includes the following. The extent to which the applicant identifies all the resources necessary to perform the proposed work and outline strategies to complete this work within a 2-year timeframe for 5 points. The extent to which the scientific environment in which the work will be done contributes to the probability of success, employs useful collaborative arrangements, and has evidence of institutional support, 5 points. And the extent to which the project proposal integrates and provides an appropriate level of research and technical knowledge and subject matter expertise, 20 points. And finally, we have the budget narrative section, which is worth 20 points. The criteria that will be used to assess the budget narrative includes the following. Does the application provide the proposed levels of effort of the project team and consultants if needed? And does it describe how they are adequate and appropriate to advance the project in accordance with the project plan? Does the application include an explanation of how the proposed budget supports the project and is cost efficient and reasonable for meeting the project activities? I'll now turn it over back to our grants team.
Thank you for joining our call today. We will give you 5 minutes remaining to submit your questions in the chat if you have any at this time. You can also follow up with additional questions after this webinar. To see the NOFO, you can log into grants.gov or apply to the link below. For assisting with the applications, grants.gov, or contact the help desk. Or you can also call 800-518-4726.